Bismillahirrahmanirrahim. Quote of the day is from Quran, and whoever puts his trust in Allah, then He will suffice him. Today, the topic of my presentation is chicken pox, and I am presenting it under the supervision of Professor Dr. Saira Afzal. Learning outlines. Learning outlines of the presentation are introduction of chickenpox, epidemiological triad, chain of transmission, clinical stages, level of prevention, and recent advances. Learning outcomes. At the end of this presentation, participants will be able to describe epidemiological triad and the prevention aspects of this infection, that is chickenpox, understand the factors that contribute to its spread and their prevention. Introduction. Chickenpox is a very contagious infection that is caused by varicella zoster virus. Varicella is a Latin word that is used to tell the chickenpox or shingles virus from its much more dangerous relative variola, which causes smallpox. Zoster is the part of virus named because it is the Greek word for girdle. Varicella zoster virus, which is a DNA virus that is a member of the herpes virus group. After the primary infection, varicella zoster virus stays in the body in the sensory nerve ganglion as a latent infection. Primary infection with varicella zoster virus causes varicella. Reactivation of latent infection can cause herpes zoster, that is shingles. Problem statement. Global annual chickenpox disease burden includes about 4.2 million severe complications leading to hospitalization and 4,200 deaths almost. In pre-vaccination era, in developed countries, case fatality rate was about 3 per lakh cases compared to 1 to 3 per thousand measles cases. The incidence and severity of herpes zoster increases with age, marked after 50 years due to decline in immunity. Adults who reach to 85 years, half would suffer at least from one episode of herpes zoster. Epidemiological determinants: agent factors, host factors, and environmental factors. Amongst the agent is varicella zoster virus, that is called human alpha herpes virus 3. Primary infection results in varicella, that is chickenpox, and recurrent infection results in herpes zoster shingles. Host factors. Age. Children under 10 years of age are more susceptible. A few escape until adulthood but can be severe in adults. Immunity. One attack gives durable immunity. Maternal antibody protects the infant for few months. No age is exempt in the absence of immunity. IgG antibodies persist for life and correlate with protection. Cell-mediated immunity is important in recovery. And in pregnancy, risk for fetus and neonate is increased. Environmental factors. It shows a seasonal trend occurring mostly during the first 6 months of the year. It also is dependent on the overcrowding, and in temperate climate, there is a little evidence of seasonal trend. Source of infection. Usually a case of chickenpox is a source of infection. Virus present in oropharyngeal secretions and lesions of skin and mucosa. Rarely, but may be a patient with herpes zoster. It can be isolated from vesicular fluid during the first 3 days of illness. Infectivity. Period of communicability is 1 to 2 days before the appearance of rash and 4 to 5 days thereafter. It tends to die out before the postular stage. Patient ceases to be infectious once the lesion has crusted. Secondary attack rate is about 90% in household contacts are found. Transmission. Droplet infection and droplet nuclei. Face-to-face, that is personal contact. Portal of entry is respiratory tract. Virus is extremely labile, so fomites unlikely to transmit. Contact infection plays a significant role when an individual with herpes is an index case. Congenital varicella, it crosses the placental barrier and infects the fetus. Incubation period for the virus is 10 to 21 days. Varicella pathogenesis. Respiratory transmission of virus is seen. Replication is in the nasopharynx and reach the lymph nodes. Repeated episodes of viremia are seen. Multiple tissues, including sensory ganglia, are infected during viremia. Clinical features are may varying from a mild illness with only scattered lesion to severe febrile illness with widespread rash. There are two stages seen, pre-eruptive stage and eruptive stage. In pre-eruptive stage, onset is sudden with mild or moderate fever, pain in back, shivering, and malaise. This stage is very brief that lasts for about 24 hours. In adults, more severe and lasts for 2 to 3 days before rash comes out. Now, eruptive stage. In children, rash is the often mostly the first sign. It comes on the day the fever starts. Distribution of rash is important in eruptive stage. It's mostly symmetrical, centripetal in distribution. What is centripetal? That it appears first on trunk and then on face, arms, and legs. It's more abundant on trunk. Mucosal surfaces are generally involved. Axilla may be affected. Palms and soles are usually not affected. Density of eruption diminishes centrifugally. The rash advances quickly through the stages of macule, papule, vesicle, pustule, and scab. This slide also shows the diagrammatic formation of macule, papule, and pustules. Pleomorphism. It is a phenomena in which appearance of all these five stages can be seen successively at the same time, and it is a characteristic feature of chickenpox. Vesicles filled with clear fluid resembling dewdrops, superficial in sight with easily ruptured walls and surrounded by an area of inflammation. Vesicles may form crust directly, and many lesions may abort. Scabbing begins about 4 to 7 days after the rash appears. Fever not high, but exacerbation with fresh cough is seen. Now, diagnosis. Diagnosis is prodromal flow grade fever, eruption of papule, vesicles, and pustule, typical dewdrop or rose petal appearance, and characteristic centripetal distribution. All these are the points that help in diagnosing the disease. Now, complications of chickenpox. It is a mild self-limiting disease. The mortality is less than 1% in uncomplicated cases. Patients at risk of complications are immunosuppressive patients, cancer patients, recipients of organ transplant, chemo, radiosteroid therapy recipients, HIV-infected children, leukemia, and pregnant patients are also at the risk. Shingles. Shingles is a long-term complication. Shingles is a viral infection that causes a painful rash. Although shingles can occur anywhere on the body, it most appears on the single strip of blisters that wraps around either the left or right side of the torso. After you've had chickenpox, the virus lies inactive in nerve tissues near the spinal cord and brain, and years later, the virus may reactivate as shingles. Shingles mostly affect only a small section of the side of body. Signs and symptoms may include burning, pain, and numbness or tingling in that area. That area is sensitive to touch. A red rash, it begins a few days after the pain, and fluid-filled blisters that break open and crust form itchy area. The picture shows a patient suffering from shingles. Transmission of shingles. A person with shingle cannot pass shingle to anyone else, but a person with shingles can pass on the virus that can cause chickenpox. A person who has been vaccinated against chickenpox is protected from exposure to a person with active shingles. Congenital varicella syndrome results from maternal infection during pregnancy. Risk appears to be low, less than 2%, and period of risk through first 20 weeks of pregnancy is much more for congenital varicella syndrome. Varicella laboratory diagnosis is the isolation of varicella virus from clinical specimen. Rapid varicella virus identification using PCR and a significant rise in varicella IgG by any standard serological assay. Differential diagnosis for the disease are vesicular exanthemas, contact dermatitis, impetigo, insect bite, drug eruption, smallpox, and other pox viruses. This picture shows differences between smallpox and chickenpox. The main smallpox has been eradicated, but the main difference amongst these is the distribution of rash. and the dewdrop pustules. This slide is also showing tables for all the differences in the incubation, prodromal stage, distribution of fresh, fever pattern, and evolution of fresh. Now, levels of prevention. There are three basic levels of prevention. Primary forms the base, then comes secondary, and then tertiary. In primary level of prevention, there is the reduction of risk factor before the occurrence of disease condition or injury. In primary, there comes health protection and specific protection, while in secondary, early detection of the potential for the development of a disease or condition is done, or the existence of a disease while the patient is asymptomatic. While in tertiary prevention is the treatment of the disease that is now has happened. Primary prevention is health promotion, specific protection. Primary prevention of the disease is done by ensuring high population immunity through immunization. Health promotion, how can you prevent chickenpox? Wash hands with soap, especially after visiting public places. Avoid direct contact with recently infected people. Use gloves and masks while taking care of the people with chickenpox. Maintain a healthy lifestyle to boost your immunity level, and vaccination. Now, specific protection is vaccines. Live attenuated vaccine. Vaccine was licensed for US use in US in March 1995. First vaccine to reduce the risk of herpes zoster was licensed in May 2006. Mild local reaction at inoculation site is 1%, and seroconversion in healthy seronegative children is over 90%. It is a monovalent vaccine, 1 or 2 doses, schedule 0.5 ml subcutaneous injections are given. Duration of immunity is probably 10 years. IgG levels are raised in blood to protect lifelong immunity. Now, varicella containing vaccines. First is varicella vaccine, Verivax. It is approved for persons 12 months and older. Second is measles, mumps, rubella, and varicella vaccine, that is Poquart. It is approved for children 12 months to 12 years. And herpes zoster vaccine, that is Zostavax, that is approved for persons 60 years or older. Varicella vaccine recommendations for children. Routine vaccination is 12 to 15 months of age. Routine second dose is 4 to 6 years of age, and minimum interval between doses younger than 13 years of age is 3 months. Varicella vaccine recommendations for adults and adolescents. All persons 13 years of age and older without evidence of varicella immunity. 2 doses separated by at least 4 weeks, and do not repeat first dose because of extended interval between doses. Measles, mumps, rubella, varicella vaccine. Approved for children 12 months to 12 years of age to age 13 years. Do not use for person 13 years and older. May be used for both first and second doses of measles, mumps, rubella, and varicella vaccine. Minimum interval between doses is 3 months. Zoster vaccine contraindications and precautions. Severe allergic reaction to a vaccine component or following a prior dose, pregnancy or planned pregnancy within 4 weeks, immunocompromised patient from any cause, AIDS or any other clinical manifestation of HIV infection, high dose corticosteroid therapy if a patient is taken, that is also contraindicated. Now, secondary prevention. Secondary prevention of spread by rapid investigation of close contact to ensure the prompt treatment. Specific prevention is live attenuated vaccine in susceptible patients and immunoglobulins. Varicella zoster immunoglobulin given within 72 hours of exposure has been recommended for prevention. Dosage is 1.25 to 5 ml intramuscularly, used for immunosuppressed contexts of acute cases or newborn contexts. It provides improvement in high-risk children with varicella. No specific treatment for chickenpox is seen in case of control of the disease. However, notification is shown. Isolation of cases for about 6 days after onset of rash. Disinfection of articles soiled by nose and throat discharges. Antiviral drugs provide effective therapy for varicella. Acyclovir, velaciclovir, and clovir, and phosphonate, etc. Treatment for mild cases, that is children, calamine lotion and antihistamines are given. In severe cases, that is adults and HIV positive, acyclovir is given 5 times. Famciclovir is given. In others, topical antibacterial ointments like mupirocin to prevent secondary bacterial infection and antipyretics are given. Tertiary prevention. Tertiary prevention of complication and deaths by early diagnosis and prompt treatment. Recent updates. An article recently published is platelet poor plasma filled biofiller, an innovative alternative to expensive hyaluronic acid based filler for the treatment of chickenpox scars. This shows that there are challenges to treat because of the punched out circular nature of the scar. These types of scar responds poorly to succeed. Injectable dermal fillers are a wonderful treatment modality for chickenpox scars with minimal adverse effects. The only disadvantage is the cost of the filler product and that it needs to be replaced every year or 6 months. Another article published is the evaluation of immunization coverage in an affluent society of Peshawar in Pakistan 2018. The study was conducted for whole 1 year. It revealed that immunization status of the children in influent society, that is Hayatabad, was satisfactory. However, it was below international standards due to the lack of information about the vaccination schedule and busy routine of parents. The coverage can be standardized by running vaccination awareness campaigns through social media. This picture shows incidence of chickenpox in different areas and in different years, and the trend is down racing continuously. This graph shows the month-wise cases of chickenpox in CMH Attack from Military Training Center. It shows that it's the most cases are seen in December and after that in November and February. So it shows that chickenpox also shows seasonal variations. Now coming towards the MCQs. First MCQ is chickenpox is a very contagious infection and is caused by varicella zoster virus. Very rarely a person can get exposed to that virus more than once. Once exposed to the infection, a person can develop chickenpox in as little as how many days? Option A is first day, option B is 6 days, option C 7 days, and option D is 1 month.
6 days.
B.
Option C is the right one, 10 days. Second MCQ is a chickenpox illness usually lasts about 4 to 7 days. The classic symptoms of chickenpox is a rash that turns into itchy fluid-filled blisters. Which of the following is true for chickenpox, that is varicella zoster infection? Option A is the incubation period is 5 days after exposure. Option B is immunocompromised children should be treated with acyclovir immediately after any exposure. Option C, children develop immune protection following chickenpox but can develop illness a further 2-3 times. And option D, vaccination is recommended as part of the routine childhood immunization course in UK. Yeah. C is the right one. C is the right one. Immunocompromised children actually should be treated only with antihistamines and antipyretics. Antivirals are not given because in children, mostly the attack is not that fatal. Option C is the right one. Third MCQ is a person ABC has painful itchy area near his right shoulder. He has had chickenpox during an outbreak in past. After causing chickenpox, the varicella zoster virus can remain in the body for years before it causes shingles. Where in the body does the virus stay? Option A in the heart cells, option B in nerve cells, option C in lung cells, and option D in skin cells.
B.
Nerve cells.
Yes, B is the right answer. Fourth MCQ is Ali is having a small group of oozing fluid-filled blisters that appear few days later in the area of pain and itching, also experiencing flu and fever. He was diagnosed as having shingles. When can a person with shingles pass shingle on to another person? Option A, never. Option B, just before the rash appears. Option C, while the rash is visible. And option D, when fever is settled.
B.
B.
Option A is the right one. A person with shingles can never pass shingles to other. However, a person with shingle can transmit virus to the other that can cause chicken pox in that one. Fifth MCQ is immunity to a disease is achieved when there are antibodies to that disease in person's immune system. Presence of lifelong immunity that is achieved after infection is detected by high levels of which of the following? Option A is IgG, option B is IgM, option C IgE, and option D IgA.
A.
Alpha.
Yes, A is the right answer. IgG levels are seen in detected. Sixth MCQ is when a woman has chicken pox in the first 20th weeks of pregnancy, there is a 1 in 50 chance for the baby to develop a set of birth defects. This is called the congenital varicella syndrome. It can be acquired by option A, direct contact, option B, airborne transmission, option C, fomites, and option D.
Delta.
D. Vertical transmission.
Yes, D is the right one. Question 7 is a person presented to OPD with the complaints of high-grade fever, flu for last 4 days, and rash was seen with blisters all over the body surface. On history taking, physician is asking multiple questions about the pattern of appearance of rash. Chickenpox rash appears first at option A is face, option B arm, option C axilla, option D trunk.
B. Arm.
B.
Option D is the right one, trunk. Because the distribution is centripetal, it appears first at trunk, and most of the rash are seen at trunk. And then it is distributed towards the arms, legs, face, and at the end, axilla. Axilla is rarely involved. Eighth MCQ is secondary prevention of spread of chickenpox is done by the rapid investigations of close contacts to ensure the proper treatment. Varicella zoster immunoglobulin levels are recommended to check after how much time in a confirmed case. Option A is 24 hours, option B is 36 hours, option C is 72 hours, and option D 1 week.
C.
C is the right one, 72 hours is the time. Ninth MCQ is varicella zoster virus immunoglobulin is made from blood and contains antibodies to the varicella zoster virus. This virus causes chickenpox and shingles. Most suitable recipient of varicella zoster virus immunoglobulin is option A, a newborn baby, option B, pregnant female, option C, 14 years old boy, and option D, an old man of 60 years.
D. Newborn baby. A. Newborn.
Pregnant female is the most suitable recipient. Newborn babies mostly receive antibodies from their mother if mother has not got any infection during her all the trimesters. 14 years old boy is not necessary for this because they mostly have immunity at this age. 10th MCQ is a sterile lyophilized preparation of oca mark stain of varicella zoster virus that can be used to prevent varicella, mostly known as chickenpox or herpes zoster, commonly known as shingle. This belongs to which group? Option A is life attenuated vaccine, option B is heat killed vaccine, option C is formalin killed vaccine, and option D toxoid, and option D immunoglobulins.
A.
A.
Yes, A is the right one, live attenuated vaccine. This is the key, and thank you.
Thank you very much, Dr. Isma. Very nice presentation, especially